See, this is the continuation of the previous video only because of some interruptions. That video was stopped in between. I'm continuing from there. So that is why I always tell the residents to take a photo, a good view box, good orientation. There should not be any shadows. On a particular section where the image finding is very important, zoom it over there so that when it comes to the image or printable document, there won't be any haziness or the picture will be very, very clear. So that is why you have to take the photo in a good orientation and with proper lighting. And many students used to think, sorry, it's a simple case. But if you are having 4 or 5 similar cases, for example, a case of UTI, a case of pyelonephritis, 5 to 6 cases if you are having, we can publish it as a case series. What is the outcome? To which antibiotic the patient responded? To which antibiotic the patient not responded? This all the stuff you can use it for publication. And the other one, if not case series, at least the pages who have completed nephro, the images that I have given you, at least use that and do the publication at the earliest. And whatever the gist of the case, I hope I already gave you. Only thing is, since the photos are with you people, you have to arrange it and put it in the Microsoft Word document and go to this format and try to publish. So in this patient, if I want to show some example, we'll go through the introduction. There is nothing much. Just we have told that this is common. What are the DD of the renal cyst? How common it is? What is the important mutation? And here we are presenting. So here we have published in 2 different case form. First we told all the details regarding case 1. Then we went to the case 2. How the clinical presented. No need to elaborate in detail. So what was the gist, how the patient presented, what is the important lab parameter similar to your case presentation, important history, examination, both vitals and specific clinical examination, basic lab and the specific investigation. In that way you have to go. And this article is already on the site, you can download, or if you want I will send you through the WhatsApp. So images we already discussed. Initially this image was also haphazard. इधर तो देख के थोड़ा अच्छा लग रहा है ना अरेंजमेंट की वजह से. Labeling this all you supposed to do. You have to add this A, B, C and all. Then you have to explain what is that transfer section or axial section, coronal section and all. Case B, basic lab and discussion. So discussion में कहाँ से पढ़ेंगे? Like you can go through any review article. No need to write everything about it basically. Some important points. Since we are focusing on the liver cyst, after saying the mutations for ADPCKD1 and 2, how severe it is, then we have mentioned a few regarding the liver cyst and what is the prognosis, how the patient usually present and how the patient complication can occur, how to manage. That's all. Few important stuff. The reviewer, once you submit it to the journal, the reviewer themselves will write back to you regarding what are the advantages and disadvantages. अगर एक जर्नल में रिजेक्ट हो गया, उन्होंने तो रिव्यू दिया होगा, उसको करेक्ट करके नेक्स्ट में भेजना है. Look at the conclusion. So even though it is a genetic disease which is silent, very difficult to detect during the early time, later time we are usually detected by the symptoms, and just a simple conclusion you can write, and this completes this case report publication. This video just for the example and how you can start your publication journey, because you might be in the first or second year or third year of the MD. At least you should be aware how to publish it. At least one article publication is mandatory. At least during your MD, you should be very aware of this. So this is an example how the images that you are capturing in the mobile in the WhatsApp can be used to publish an article. So this is the certificate that we got. So that's all. Bye bye.